Epilepsy is one of the common chronological brain disorders in the world, with approximately 1% of the world population being affected. In Uganda, the prevalence stands between 1 to 2% of the total population, a representation of 770,000 Ugandans living with the disease. The manifestation of this condition varies depending on the specific body part that is affected. Tremors in certain body parts, along with other symptoms, often leave many individuals in Uganda feeling hopeless and without any prospects for recovery. However, speaking to the media during the launch of the epilepsy surgery at Makerere College of Health Sciences in Mulago, Dr. Juliet, Naku, the Deputy Executive Director for Butabika National Referral Hospital, revealed that this deadly and scary disease can now be cured and giving hope to Ugandans. Dr. Naku had represented the Minister for Health, Dr. Ruth Acheng, during the commemoration of the International Epilepsy Day 2024.
Past, people thought maybe epilepsy didn't heal, but now we know that some forms of epilepsy do actually cure. There are forms of epilepsy which are self-limiting, like the juvenile epilepsies. When children get to about 15, 16, 17 years, some of those may go away and not return.
She, however, says much as they are trying their best to have epilepsy cured, there is still a big challenge of resources, hence calling upon all stakeholders, including the government, to be supportive to this program.
Starting that kind of epilepsy, which we are calling epilepsy surgery, to try and free people from epileptic seizures. I think this is going to be life-changing for many people, especially children, and we pray that we get support from everybody, from the community, from the medical profession, from the government, so that this service can be spread.
She further explained that 20% of the patients who report to Butabika Hospital plus other medical clinics are epilepsy, an indication that the disease is on a surge.
I've seen in our health facilities around the country where we run mental health clinics that about 20 to 30% of people who attend mental health clinics around the country actually have epilepsy. So the numbers are huge out there in the communities. And so we need this awareness to go around so that many people can get to know and they can come to get treatment.
Dr. Richard Idro, the Associate Professor of Pediatrics and Child Health at Makerere University, explained that 23 people have so far been operated since 2015, but stressing that they are improving in the area of capacity building by training more personnel.
We have had 23 children operated on. The first 10 about 2015, and then the 13 in the recent days. 8 in Kiwa Hospital in Bale, the other 5 in the hospitals around Kampala. We have programs here. We are training technicians who conduct the neurophysiological tests, the EEGs. That one has been going on through the Mulago Makerere Epilepsy project. And then for specialists, we are currently training quite a number of people.
Ms. Nekesa Sarah, the Executive Director, Epilepsy Support Association Uganda, an organization that specializes in helping people with epilepsy, raised a concern about the existing knowledge and treatment gap, saying the medicines are not readily available in Uganda.
There's a very big challenge around knowledge. There is a knowledge gap in epilepsy. Not every medic understands epilepsy, and there is also a treatment gap because there is also the drugs that are available are not readily available in Uganda. So persons with epilepsy, drugs are a meal for them. However, when they go to such facilities, most especially in rural settings, the drugs are not readily available, which precipitates their seizures.
Church of Uganda Family TV spoke to one Nakitende Victoria, a mother to an epileptic child, and this expressed the high stigma attached to the child by the community as the major challenge she encounters.
Omwana ono bamuvuma nnyo, bamuchokoza nnyo, netuuka okugamba senga oba nalina ssente omwana andimututte mu kisulo n'avaawoko kuba ye buli ssaawa gwe bakuba gwe bawaayiriza kati bwe bityo.
John Baptist Ahumuza, Church of Uganda Family TV News at 8.